Okay, welcome back. This is the presentation entitled "So What is Therapeutic Hypnosis?" And what I'm talking about here is hypnosis with a small h, and it's a technique. It's not an element. I have an issue with the concept of hypnotherapy. So as a reminder, here is the sky where we will see symptoms. Down in the sea, we've got the hidden subconscious events. In the terms of hypnosis, in the sky above, we will see the conscious, and underneath, we will have the subconscious. So I'm going to disappear again, so I'm not a distraction. We'll have a look at this, and here we go. So, what is hypnosis? This is what I've drawn as the sort of human iceberg, where the critical conscious faculty represents about 20% of the brain, the subconscious is the other 80%, and the subconscious is what we are aware of and what we have control over. Subconscious, we tend not to. We can't access the subconscious while it's submerged. So what hypnosis attempts to do is to pull the conscious critical faculty down under the water so that the conscious critical faculty is less critical, and to raise the subconscious up above into an area where we can actually then access it. Because if you remember from the introduction, I was saying that below the surface, the autonomic system and the subconscious parts control inflammation, metabolic function, immune system, hormone balance. We don't have control of those. But maybe if we can get access to them, we can have more control than we think. So again, with the hypnosis, we're trying to turn this human iceberg to submerge it so that we can have a greater effect. So if we can turn it on its side, then we can get direct access to the subconscious. And hypnosis is the tool that we use to access it. Now, within the subconscious, we've got our thinking, feeling, emotion, but ultimately, right down at the bottom, all these things are driven by our physiology. Detailed chemistry, detailed science. And that if we can access the physiology, then we can start to change our emotions, our feeling, our thinking, and therefore our behaviour that we would see at the top. So by pulling this down, the hypnosis allows us a greater control of the physiology that drives the system. So we're all about trying to change the physiology, and this is where I'm talking about it being an holistic scientific approach. So the therapeutic use of hypnosis is a tool to access the subsurface drivers of disease process and allow the body to naturally regulate and assist in the healing process, which, if you remember, is the aim of all therapies: medicine, surgery, pharmacology. Getting the body to heal itself by being assisted, and to fail to use hypnosis seems to be an act of omission. So we combine this approach with surgery and drug therapies, we will improve the outcomes. We'll have to give less drugs. If, for example, you were giving intravenous sedation, if you use hypnosis with that drug, then you will use lower concentrations. Your patient will be less heavily sedated. They will recover faster. They will have fewer side effects. And this is why I consider it as a therapeutic tool as part of an holistic approach to all elements of healthcare, and in fact to everything that we do in terms of well-being. So on the next slide, it's just going to going to illustrate the complexity of the system. Now, the genetics can't be changed, but therapeutic hypnosis can help with direct approaches and with the control of anxiety and sleep drivers, which are drivers of the disease processes. So it's got that use. So let me now put it all together. So here you've got this unbelievably complex system, and most of what we do is targeted at one element rather than all of it, and we must look at all of it. And on this particular slide, I've thrown in stress, caffeine, alcohol, medications. You can throw in a whole load of other things into the sea there to cause contamination and to affect the microbiome, to affect the genetics, and everything will have an effect. So we really need to have this big picture, and the philosophy of hypnosis is an attempt to deal with this. So, in short, I think that the hypnosis should really be used as something which we should do in all elements of medicine. In my case, I pointed out that it was the first postgraduate course that I did after qualification, and I used it a lot to begin with formally, but throughout my career I've used it informally in almost every setting, and it has to be included as a philosophy of how we deliver care. So in the next presentation I'm just going to talk about the training that is provided by the British Society for Clinical and Academic Hypnosis, and I'm going to talk about the therapeutic uses in general that we can put it to, and try to give you some reason why I think it would be worth you giving up 2 or 3 weekends to come and learn a little more about it. So thank you for listening.